welcome to Radiology Today. In our studio, we have two surprise guests, Dr. Bell and Dr. Krug. What are we going to be talking about today?
Well, we're going to be talking about a rare congenital disease called Osteogenesis Imperfecta. It occurs in 1 in 10,000 to 20,000 births, and it is also called brittle bone disease.
Wow, so does this disease have different types?
Well, this disease is shown in two different characteristics known as congenital and tarda. Congenital is present at birth, while tarda doesn't become evident until later into adulthood. These are then broken down into 5 types.
Osteogenesis imperfecta is caused by a defect in the type 1 collagen gene, which typically creates the building blocks of bone.
It is also an autosomal dominant disease, and there is a 50% chance that it will be passed along to the patient's offspring.
Complications of osteogenesis imperfecta are hearing loss, heart failure, pneumonias, and respiration problems due to the chest wall deformity. There are also permanent deformities to long bones and spinal cord and brainstem issues.
When we come back from this commercial break, we'll have some insight from our radiologic technologist on how imaging assists diagnosis and evaluation of OI.
She's had more than a dozen fractures. And in the next few years, she faces 2 major surgeries to strengthen her fragile bones. She's only 10 years old. Most people don't worry about fragile bones until late in life. For those with osteogenesis imperfecta, brittle bones are a concern throughout their lifetime. Help these families get the support they need.
Welcome back to Radiology Today. I'm now pleased to introduce our radiologic technologist, Morgan.
Thank you, Rachel.
Morgan, how is osteogenesis imperfecta shown on radiographs?
Well, the radiographs demonstrate any bony anomalies such as fractures, calluses, and bowing of the long bones. The X-ray will also show evidence of osteoporosis, overtubulation, thin bony cortexes, and widely spread trabeculi.
Is it true that X-ray is used as the initial diagnosis?
Yes, because the images are easy to obtain with a lower dose of radiation than CT and demonstrates old and new fractures.
Well, CT and MRI, how do they play a role in imaging osteogenesis imperfecta?
CT will show any basilar imperfections and abnormal bone density, while MRI is typically used to diagnose associated complications from OI.
What about ultrasound? Is that a modality that's used to diagnose this disease?
Ultrasound is typically used prenatally. It can show fractures, calvaria, and a decrease in calvarial ossification. I have a few images of osteogenesis imperfecta. Would you be able to show them on the screen?
Yeah, let's put them up.
Image 1 shows the types of osteogenesis imperfecta. Image number 2 shows the bowed legs. Image number 3 shows a callus. And image number 4 shows a major displacement and a Montego fracture.
Thanks, Morgan, for showing us those. And we'll be right back after this commercial break.
Kay Tate is extremely fragile. She has a petite 3'9" frame that means she is often mistaken for a child. Tate suffers from osteogenesis imperfecta, a genetic disease that makes the whites of her eyes slightly blue and means her bones are collagen deficient. The deficiency makes her bones extremely brittle. Tate was wheelchair bound until she was 14 and would crack a bone by just sneezing or walking. Determined to lead a normal life, she gave birth when she was 19, despite breaking her leg again and ending up back in a wheelchair.
Alright, back with us again are Dr. Krug and Dr. Bell. Now that we've heard all about osteogenesis imperfecta, what types of treatments are available for patients with the disease?
Well, there's actually no cure at all for this.
However, therapy is widely used with patients that have type 1 OI because they have the mildest form. Therapies use low-impact exercises to help maintain strong muscles.
More severe cases, such as type 2 and type 3, may be treated surgically by a procedure called rodding, which is when metal rods are placed into the long bones to help strengthen and cause them to have less fractures.
During this process, fractures may still occur but will heal normally.
What type of outcome will these patients have?
Well, determining the type of OI that they have, it will determine how the rest of their life is affected.
Patients with the most common type, type 1, will live with a normal lifespan and may have to have mobility assistance and routine checkups.
Type 2 is the most severe form, and it will determine the outcome of the rest of their life, which it may also cause death right after birth or shortly after.
Types 3 and 4 typically have a near normal life expectancy. Patients with these types are usually bound to mobility assistance for the rest of their lives, such as braces, crutches, or wheelchairs.
Type 5 is the newest form of osteogenesis imperfecta, which causes the patients to have osteoporosis, hypertrophic calluses, interosseous membrane ossification.
All right, well, that's all we have time for today. We want to thank our special guests, Dr. Bell and Dr. Krug. And Morgan is not with us because she had to leave. She was on call for emergency in the ER, and that's all we have for you today on Radiology Today.